Hello everyone, we are going to talk about informed consent.
What is the informed consent? The informed consent is describing in ethical codes and regulations for human subject research. The goal of the informed consent process is to provide sufficient information to a potential participant in a language which is easily understood by him or her so that she or he can make the voluntary decision regarding to or not to participate in the research study. Informed consent is not only required for clinical trials, but it is an essential prerequisite before enrolling each and every participant in any type of research involving human subjects, including diagnostic, therapeutic, interventional, social, and behavioral studies. Obtaining consent involves informing the subject about his or her rights, the purpose of the study, the procedures to be undergone, the potential risks or benefits of participation, and alternative treatments available events.
So now we are going to talk about the classification of the informed consent. So it's classified in consent, parental consent, assent, short form, and verbal. So what is consent? Consent is when an adult subject capable of giving permission to participate in a research study can provide consent. The subject must be 18 years of age and competent to make the decision to participate. Parental consent means when children are included in research, the parent must sign a parental permission consent document. Some situations require permission from at least one parent, while other situations require permission from both parents. Now we are going to talk about verbal. Verbal consent still contains all elements of written consent. However, the participant verbally reads the elements and verbally agrees to participate. The last one is the short form, generally used when there is a language barrier and an approved consent is orally translated in the subject's native language.
The benefits of obtaining informed consent extend beyond the simple transmission of information from someone who has knowledge, that is the physician, to someone who doesn't, that is the patient. The benefits are protecting the patient's right of self-determination, engaging the patient in his or her healthcare, enhancing the physician-patient relationship, and reducing the discontent and litigation when there are complications.